I think there's really two pieces. The first one is give us complete information. It's not just about price. So I need, financial and cost information, and that includes information on reimbursement if it's that type of supply or product. I also need, of course, all the clinical evidence because that's really where we're going. And we're looking for clinical evidence that's not really funded necessarily and paid for by the supplier, but we want independent if it's available. And getting those pieces are important. But another thing for us, and we're actually a state agency, so we have very strict contracting requirements. So getting that information on the front end for us is essential because our process is very long to do some of those things. So just having all that information up front so we can make an informed decision, because if the pricing is good and the information is good, but I can't get to a contract, it's irrelevant because that's a requirement that I can't suspend, for example. So I think that's one piece of advice. The second piece is involve supply chain early. Nothing is more frustrating, and I've been doing this a long time, is when they are working with the clinicians and the physicians. And I understand that they have to work with them because I'm not clinical. Although some of my team is, I am not. So that's their selling point and entry into the facility. But we come in so late in the process, and sometimes we'll have a contractual obligation that will truly roadblock us from doing this even if we want to do it, or we'll have to be very creative in order to make it happen. So all we want to do is to bring us in early and let us help you facilitate. Because on a lot of these things, I don't have really any issue of what we use. I leave that up to the experts who are treating patients. But I have to manage the business processes and the business aspect of it. And when we're left out until the very end, sometimes people are disappointed, and then really it affects the patients at the end step because they don't necessarily get what they need. I don't ever want that to happen. We are a huge patient advocate in supply chain at UMMC. And that's one thing I'd really ask for the suppliers is, we're nice people, so you just come and talk to us and we'll help you. And if we can't help you, we'll tell you why. And we'll try to figure out a way to make it happen. So I think that'd probably be my two areas of advice for suppliers.
Good advice.
All right, great.
Good advice, Bill.